time, and we will begin promptly at 2 p.m. Eastern Time. Until then, I'll just mute this line and continue to wait for others to arrive. Thanks for joining us. Good afternoon. This is Stan Kautstall, Program Manager for the Health Profession Opportunity Grants Program, and we're going to get underway in just a couple of minutes with the HPOG orientation call. Welcome to those of you that have joined, and we'll just I'll mute my line here, and we'll get underway in just 1 or 2 minutes. Jennifer, will the recording start automatically, or is that something that you trigger?
I actually trigger it, but I have it started just because when you started talking at first, I wasn't sure if you were going to make any type of announcement. So.
Oh, okay.
But I can delete that part out, so
yep,
whenever you're ready to start.
Okay, thanks so much. Okay, this is Stan Kautstall, the Program Manager for the Health Profession Opportunity Grants Program, and it's 2 o'clock, so we're going to get underway. Let me begin by first saying congratulations to those of you that are new to HPOG. Thank you, too, for taking time out of your Friday afternoon to join this call. I want to apologize that we had some technical difficulties with our call on Wednesday. Hopefully, this goes much more smoothly, and for those that are unable to attend for this particular webinar, this webinar is being recorded and is going to be made accessible for others in the days ahead. So again, congratulations. We're excited because over the next 5 years, we're going to serve a lot of people, and we're going to learn a lot, and hopefully the things that we learn will make a difference not only for the people that we're serving immediately, but will also inform how we go about serving people in the future. The Health Profession Opportunity Grants Program, or HPOG as we call it, is funding 32 grants across the country, totaling a little bit less than $72 million a year. There were 2 funding opportunity announcements. The funding opportunity announcements, we have an acronym for, that's FOA, and we often call it the FOA. So the 2 funding opportunity announcements, one was open to a variety of organizational types, and one was limited to tribal organizations. The authorizing legislation that brought the HPOG program into existence requires that we make at least 3 awards to tribal organizations, and we've in fact made 5 awards to tribal organizations for HPOG 2.0. This is the same number of awards as we made for the initial round of HPOG as well. The organizations that we have funded include institutions of higher education, workforce investment boards, nonprofit organizations, state agencies, and tribal organizations. The Administration for Children and Families, or ACF, has 10 regions, 10 regional offices, and each regional office has a number of states for which they're responsible or which they serve. And HPOG grants, there's at least one HPOG grant in each of the 10 ACF regions. HPOG grants are spread across 21 states in total. 17 of the HPOG awards were made to organizations that were previous grantees, and 15 of the awards were made to organizations that are new to HPOG. There are a couple of distinctions between HPOG 1.0 and HPOG 2.0 that I'll highlight very briefly before telling you more about the program and what's in store for the next few years. One of the distinctions is that we more strongly emphasized adult basic skills education. And we did that because when we're thinking about developing a career pathway, we really want it to be a career pathway that's more accessible to more people. And we think that including adult basic skills education is an important part of that. We also placed stronger emphasis on the use of labor market information. In particular, we looked for all of the applicants to use the labor market information to show us that the occupations for which they're going to be providing training are actually in high demand, so that when participants complete the training, that they have a really good prospect of actually getting a job in the occupation for which they were provided training. We've also looked for ways to more strongly emphasize career pathways. HPOG has always been a career pathways program, but we're looking for ways to more strongly encourage not just gaining an entry-level job, but what it looks like to continue along a career pathway, so that we're not just helping people to the first step of the first rung on the career ladder, but that it's really a program that helps them along a career pathway. We're also continuing to do a rigorous evaluation. We did a rigorous evaluation. We are doing a rigorous evaluation for HPOG 1.0, but we feel that we've raised the bar with HPOG 2.0, and we've done that in a couple of ways. For one, all of the non-tribal grantees will be participating in a randomized control trial where the participants they serve are randomly assigned to either the HPOG group, which is the treatment group, or a control group, which is eligible for services that are normally provided in the community. So in addition to every grantee that's not a tribal organization being required to participate in that, we've also strongly encouraged identifying data coordinators to ensure that data is being accurately entered into a data system, and to make sure that the data that's in the data system is actually used to inform and guide program decision making. The data system itself is called PAGES, and you heard a little bit about that from the Office of Planning, Research, and Evaluation. We're very excited that in this round of HPOG grants, the data system is going to be accessible from the beginning of the program. In the first round, it wasn't available until the second year of the program. So we think we're a little bit ahead of the curve this time, and we're excited about that. So I'm going to begin to tell you more about the important people for you to know through this grant period. Let me also just note that I'll go through the presentation, and at the conclusion of the presentation there will be time for questions. And if you have any questions at that point in time, you can type questions that you have into the chat field, the chat box, and at the conclusion I'll read those questions and do the best I can to answer them. So just make notes of questions that you may have as we go along. So some of the people that are important for you to know is the HPOG team. So as I mentioned before, I'm Stan Couchstall, and I'm the program manager, and there's 3 others that make up the team, and they're program specialists. And for each of the program specialists, grant assignments are made, and that includes Kim Stupica-Dobbs, Blair Corcoran de Castillo, and Kalia Thomas. If you are a returning grantee, the one name that you'll notice that's missing is David Camparelli. He did a lot of good work for us in HPOG 1.0, but we're happy for him because he recently received a promotion and will be working at the Employment and Training Administration for the U.S. Department of Labor. So the next couple of slides show what the grant assignments are for each of the program specialists. And at this point in time, I'm just going to simply click through them relatively quickly because you should have already heard from your program specialist, and hopefully you know who they are, and you've received emails from them, and you've probably spoken to them. And they're generally your first point of contact for many of the questions that you'll have. In particular, when you think about the questions that come up and the reasons that you'll want to interact with them, anything that requires prior approval, they'll be your first point of contact. If you submit amendments, when you submit your performance progress reports, when you submit non-compete and continuation applications, when you submit requests for technical assistance, when you're developing your 120-day work plan, it's your program specialist with whom you'll have the most interaction. In addition to working with your program specialist, there's a lot of information about HPOG online, and I would want to draw your attention to that. So the first bullet gives the home page for the HPOG program. The home page for the HPOG program is embedded in a much larger infrastructure where there's information about a lot of ACF programs. So this is the link to the HPOG program. And on that page, you can sign up so that you begin receiving listserv announcements, which will be sent out. There's also a very helpful tab that shows grantee FAQs, and those grantee FAQs have information about many of the questions that you're likely to have, like when do I submit an amendment and when do I simply submit a grant note? And that's in reference to the use of what we call grant solutions, which I'll talk about in a minute. But there's other questions like how do I gain access to grant solutions, and lots of other things that will help you in finding information about many of the tasks that you have to do. We also have links on our homepage to our Facebook and Twitter accounts. We'd love for you to like us and follow us, and we would also love for you to put our logo on your own website and link to us from that, and you can be in touch with your program specialist to get our logo and to begin making those arrangements. Just one other thing that also comes to mind about the grantee FAQs, even a lot of the information that we'll be posting here today and talking about today, there's information on the FAQ section about that. And even I believe this webinar will ultimately be posted there. We also work very closely with colleagues from the Office of Planning, Research, and Evaluation. The acronym is OPRE. And the OPRE team, you actually heard from Hillary Forster yesterday, and with her seated at the table were Nicole Constance and Amelia Popham. They comprise the evaluation team, and hopefully you got a better understanding of what that means yesterday from the webinar that they presented, and I won't go into great detail about that today, but you'll hear their names and you'll see their names in the days and months ahead. We also work closely with the Office of Grants Management, which is OGM. And in some ways, you're actually more likely to have interaction with the OGM team than the OPRE team, at least direct contact. Tim Chappell is the Grants Management Officer, and he's my counterpart on the OGM team. He has several grant specialists, Ruth Hopkins, Sheila Miller, and Kim Martin. And what they do is they perform any financial reviews related to the HPOG program. So when we review applications or amendments or performance progress reports, we look at things primarily through the lens of the program. What does this mean in terms of implementation? Tim Chappell and his team look at it from the perspective of how does this look financially? Is it reasonable? Is it allowable? Those kinds of things. And anytime you submit an amendment will be reviewed first by us here in the program office, by the program team, and then it will be forwarded to the OGM team for their review. So I have several slides that show the grant specialists and the grants that are assigned to each of them, so that you'll know who it is that you can be contacting should you have questions related to your budget and financial aspects of your grant. I also want to tell you briefly about the contractor team. We have three contractors that provide support for our technical assistance efforts. So I'll actually begin with the middle one. Capital Consulting Corporation is our logistical support contractor, and we're particularly grateful for the support that they're providing today because our prior attempt at doing a webinar was a do-it-yourself effort, and we ran out of conference call lines. But now that we're more strongly engaged with them, since that contract also had a similar startup timeline to the grants, now that we're working more closely with them, they've been able to provide support for this, and they'll be continuing to provide support for webinars for an annual meeting. We anticipate that the first annual meeting will be sometime in February, and there will likely be some roundtables meetings in March and April. While there would be multiple roundtable meetings, it's likely that grantees would only go to one of them. So we don't have any dates about the annual meeting or the roundtable meeting to which you would be going, but a very broad brushstroke is that they're going to be offered in February, March, and April, but much more information to come about that. Our strategic communication contractor is Brunette Garcia Advertising, and they are going to help us with the website management and maintenance they'll also help us develop a communication plan so that we can figure out the best way to share the things that we're learning from this program, not just with HPOG grantees themselves, but also a much broader group of stakeholders that would be interested in what it is that we're doing. If we find strategies that seem particularly effective, then those are the kinds of things that we would want to promote so that they can be adopted more broadly. They'll also be helping us think through what the best mechanism might be for grantees to interact with one another. So that may be some social media platform. It may be one of our existing social media platforms like Facebook or Twitter, or it may be something else. We know that there's an interest on the part of grantees to learn from each other. We certainly do that in person at our annual meetings, but we also want to sort of reinforce and encourage that learning when we're not together through some form of social media or some other communication tool. Lastly, JBS International is our individualized technical assistance contractor, and they'll be making site visits, and they'll also be drafting written reports. The written reports are likely to be topical. Some of the topics that our leadership here in the Office of Family Assistance are particularly interested in are things like two-generation approaches, which are approaches that not only address the needs of adults and parents, but also simultaneously are figuring out how are those services that are provided for parents coordinated with services that might be provided for children so that the whole family is served and can get ahead. Another topic is partnership building for the implementation of the Workforce Innovation and Opportunity Act, or WIOA, and we know that many of you are going to be doing that simply by virtue of the kind of organization that you are, and those are the kinds of partnerships that we want to be encouraging anyway. So as they're drafting technical assistance materials, it's very likely that they may plan some of their site visits in conjunction with that, so that the paper that's drafted will be informed by observations that they make in the field and some of the technical assistance that they're delivering. So now we're going to do a deeper dive into some of the requirements that are given in the cooperative agreement and the funding opportunity announcement. And so let's begin with participant eligibility. There's two areas that are of particular interest here. One has to do with income and the other has to do with citizenship. So we expect all of our grantees to be determining the eligibility of participants based on their income. We are a program that's designed to serve TANF recipients and other low-income individuals. The way in which low income is defined varies from one grantee to the next. That definition of what it means to be low income is something that was included in your grant application, and so that's what we're going to hold you to. If there's questions about it, that's one of the things that will be clarified during the 120-day planning period. It will also likely be captured and reviewed during the evaluation, design, and implementation planning process. It's also something that we'll ask for you to describe consistently in each of your performance progress reports. In terms of citizenship, we stick very closely to the information that's given in the funding opportunity announcement. And the burden for making sure that you're serving people that are eligible really falls to you. The funding opportunity announcement states that program eligibility is limited to individuals who are citizens of the United States or who meet the immigrant eligibility requirements for federal public benefits. HPOG programs are responsible for verifying the citizenship or immigrant eligibility of potential beneficiaries. So that's something that we expect that you'll be doing. One of the more common questions that we've received about individual eligibility has to do with those individuals who are granted deferred action for childhood arrival. So that is individuals who are not citizens, but who came to the United States before their 16th birthday and have lived here continuously and meet some other qualifications and have sought consideration for deferred action so that they are not deported to their country of origin. While these individuals may have actions against them deferred, they are not eligible for federal benefits and therefore not eligible to participate in the HPOG program. Then pages 37 to 39 provide more of the funding restrictions. And the first part, if you haven't already done so, I would strongly encourage that you do get a copy of the funding opportunity announcement or the FOA, and that you read it, because it's a very helpful document to be familiar with. I know that in many cases there's one part of the organization where grants may be written and another part of the organization where it may be implemented, but even those who are implementing it should be very familiar with what the requirements were and are. So the first part of the funding restrictions simply is a restatement of the funding restrictions given in the authorizing legislation. They're basically cut and paste. Secondly, there's some implication for supportive services, and I'll talk about that more when I talk about one of the attachments that I sent to you. And then there's a third section in there that talks about program planning and administrative requirements. And there's a few issues in particular that are highlighted. One has to do with non-supplanting of funds. The idea here is that if there's activities that were previously funded by some other funding stream before HPOG, our expectation is that HPOG dollars aren't simply replacing that. And I think that this is consistent with other parts of the FOA that encourage leveraging existing services and building on them and not simply replacing them or extending them as they are. We're particularly interested in the parts of a program, the aspects of a program that makes HPOG unique. This is going to be one of the things that also strengthens the evaluation, because through the evaluation we'll be comparing the treatment group to the control group, and the greater the differences that exist between the control and the treatment group, the more likely it becomes that we'll actually observe an impact of the HPOG program. The second bullet is that HPOG funds are to serve HPOG participants. So HPOG funds generally aren't to be used for individuals that are not enrolled in the HPOG program. This can become a little bit challenging and tricky to figure out when you're paying for a teacher who is providing instruction for a class that's a mix of HPOG students and non-HPOG students. And in cases like that, we would expect that if HPOG is paying for the instructor, that the instructor is being paid in proportion to the proportion of HPOG students that are being served. So that's one thing to keep in mind. Also, related to this is that for grantees that are continuing, HPOG 1.0 funds should be used for HPOG 1.0 activities and participants, whereas HPOG 2.0 funds should be only used for 2.0 activities and participants. Funds should not be used for both tuition and faculty. It should be paid for one or the other. The challenge here is that our assumption is that when students pay tuition, that some portion of that tuition supports the faculty person. And so if we're paying both tuition and faculty, then we in essence would be paying 2 times for the same thing, and that's something that we need to avoid. There's also a bullet that notes that grantees should plan to spend all allocated annual funds. So if you're making satisfactory progress and if there continues to be funding available from the government, then each year you'll submit a non-competing continuation application and you would be provided additional funding for another year. It really works out best if you make plans to spend all of the funding for a particular year within that year and avoid as much as possible the need to carry over funding from one year to the next. And I know that this is made challenging because the cycle of the academic calendar doesn't always fit neatly with the fiscal calendar that we use. Nonetheless, you need to find the best way that you can to make plans to spend all of your funding for a given budget period in that budget period. Okay, one of the attachments that I sent is a list of items requiring prior approval, and I'd like to spend a few minutes going through that. One thing that you'll need prior approval for is hiring key staff. Key staff includes the principal investigator, program or project director, which is also known as the PIPD. And it also includes other individuals who contribute to the programmatic development or execution of a project or program in a substantive, measurable way, whether or not they receive salaries or compensations under the grant. So generally what we do is if there's staff who are supervisory in nature or making key programmatic decisions, those are staff that you will need to have prior approval before making an offer of employment. In order to obtain prior approval, you'll need to submit a grant note into the grant solution system, and that includes their resume. For the first person that you do, you would also have to include a grant note that provides your organization's personnel or hiring procedures and a written explanation that details the steps that you took to make sure that the organization is actually following those procedures. So that's hiring key staff. Dissemination materials, there's 2 broad categories of dissemination materials, written documents and electronic media. Again, for prior approval, you would submit a grant note in the grant solution system. Any written materials that you'll be disseminating need to have a disclaimer statement along with the HPOG logo, and they must state this document was supported by the grant number and some additional details there. And a more condensed version of that disclaimer may be used if there are time or space constraints, and you'll want to work with your program specialist on that. Incentives, gift cards, and gas cards all kind of relate to the same thing. One of the funding restrictions that we have is that HPOG funds may not be used for paying participants any kind of offering them a cash payment or even paying them in return for some kind of employment that you as the grantee have employed them to do. So we have some fairly specific guidance about how to do incentives and gift cards and gas cards. What we're trying to be particularly cautious about is that gift cards do not become sort of the workaround for the cash payment. When we're using gift cards and gas cards, we want to do so in a way that is providing a supportive service and not simply providing a cash payment to a participant. All incentives and gift cards must be allowable and reasonable amounts as determined by the cost principles. The cost principles can be found in a section of the Code of Federal Regulations, or the CFR. In particular, they can be found at 45 CFR Part 75. On your Notice of Grant Award, there's some terms and conditions that point you to the sections of the CFR that are relevant to your grant. And within the last year, there's actually been a change. So it used to be 45 CFR Parts 74 or 92. Now those Part 74 and Part 92 have been consolidated into one place along with the cost principles, which were not included in that CFR at all. And so the regulations pertaining to your grant and the cost principles can all be found at 45 CFR 75. One more note about the gift cards and the gas cards. We want to make sure that they are restricted from being used for things like alcohol, firearms, tobacco, or entertainment, because those would not be allowable costs for grant funds. Medical care, room and board are similar in that they are an allowable cost. However, you must demonstrate to us that they are an integral but subordinate part of the HPOG funded program. Things like room and board can get very expensive very quickly, and we're first and foremost an education and training program, not a housing program. And that's the kind of thing where we would really be looking and trusting you to look for other community resources and leverage them, because there are housing programs, and the primary and use your HPOG funds so that they're fulfilling the primary purpose of the grant. They are allowable, and if it is something that you do plan to do, there's an approval an approval process which requires that you submit a grant note with your proposed policy for how you're going to be implementing your support for those particular services. On-the-job training is allowable. However, this is another area where, again, since grant funds can't be used to make cash payments and can't be used for subsidized employment, we need to be very sure that grant funds that are used for on-the-job training are used to help an employer provide the training, but not used for an employer to make the payments to the grant participants. So if that's something that you're planning to do, you'll want to upload the contract that you have with the employer, and that'll be something that we review here. We also require that if you add any healthcare occupation trainings to the to your program, that you submit labor market information and a justification that explains your confidence that once you provide training, that it's training that will lead to a job. There's a couple of other things that I also sent as attachments that also are items that require prior approval, and those are contracts and MOUs. I'll talk about MOUs first. The MOUs, in the first round of HPOG, we required grantees to provide MOUs for all of the required partners. The required partners include state and local workforce investment boards, the state TANF agency, and the State Office of Apprenticeship, or in states where there is no State Office of Apprenticeship, the Federal Office of Apprenticeship. What we discovered is that obtaining those MOUs can be a major administrative burden and don't necessarily ensure that a strong partnership is being built. So the required partners are still required partners, but we're not requiring that an MOU be used to demonstrate your relationship with them. We do believe that MOUs can be a very useful tool to formalize a relationship and to make sure that there's a clear understanding of roles and responsibilities for each of the organizations. But while there's value in it, it's not something that we're prescribing uniformly for all required partners among all of the grantees. For contracts, all contracts must also be reviewed and approved by the federal staff before they're executed. This is an important point, if you already, if you gave the name of your contractor in the grant application already, then that contract does not need to be competed. But we do want to maximize competition where possible. So if there's not a contractor named in your application, then we would expect that it be competed. At a minimum, we would expect that you adhere to what your procurement policies are. And as with the, just like you'd submit your personnel and hiring policies for key staff, we would ask that you submit your procurement policy and an explanation of how it is that you're following your own procurement policy in awarding contracts. Another similarity between the key personnel and the contractors is if key personnel are identified in the application, then that's great. If they're not, then again, we would expect that you maximize competition to hire folks, and at a minimum, that you would be following your own established procurement policy. For those folks that are operating both HPOG 1.0 and 2.0 programs, there's a couple of things to keep in mind. Personnel must be allocated appropriately. So there's some grantees that receive no-cost extensions for a period of 6 months, and if a project director, for example, is shown as being 100% funded by the no-cost extension, then they shouldn't also be funded by the new award at 100%. Again, it just has to do, we don't want to pay 2 times for the same thing. We should only be paying 1 time for one person if that's how many people are working. So another thing to keep in mind is that HPOG 1.0 student data is recorded in the Performance Reporting System, or PRS. HPOG 2.0 student data will be recorded in pages, and so you'll updating your program level data in the pages system will be one of the ways in which you'll be able to draw a very clear line between HPOG 1.0 and HPOG 2.0. And just also a quick reminder that whoever has been assigned for your HPOG 2.0 program will also be serving as your program specialist for the HPOG 1.0 program. Grant Solutions I've referenced a couple of times. Grant Solutions is the official grant file. It's the place where all grant actions are processed, where you upload your cooperative agreements, which you should do immediately if you haven't already done so. It's also the place that you'll submit semi-annual progress reports and in your SF-425 or the financial report, and you'll also submit items requiring prior approval there. A couple other comments about Grant Solutions. In order to use the Grant Solution system, you have to submit a grantee user request form and a security compliance statement as a grant note for the authorized organizational representative and the project director. If you're a new grantee, the grantee user request form has a request type. It gives you like 3 options to select at the top, and you should select new account. If you're a previous grantee, you may simply leave that blank because there's really not a category among those 3 that describes you very well. Other program staff that are given access to Grant Solutions should also submit forms, but those forms, rather than submitting them as a grant note, those forms should be submitted to the Grant Solutions Help Desk. I provided an attachment which includes the user request form and the security compliance statement, but there's also an FAQ where a link to that form can also be found. This is a brief list of description of how students will be enrolled. It's something which Hillary also described from the Office of Planning, Research, and Evaluation yesterday. All grantees must send a list of sites in the name or email of and email of staff persons filling the data coordinator role. One way in which you'll have interaction with us here at the program office is that you'll have to submit to us the user account form so that we can sign it and verify that, yes, the program contact person will be serving as a grantee manager. I know that in reality, some of the project directors, some of the program contacts won't be serving as the grantee manager in the data system. That's a role that may be delegated to another person, like the data coordinator, and each of the grantees may have multiple grantee managers. We're only going to vouch for the grantee manager who is the PIPD because we have your name and information from other things. You're listed on the Notice of Grant Award and other things like that. So there's going to be an initial grantee training next week. Then you will have been sent by then program data entry spreadsheets, and you'll want to begin filling those out. The Pages team and the OFEA team will review those spreadsheets, and the spreadsheet will be uploaded into Pages. Pages user accounts will be set up, and the users will complete basic training in security awareness. training. Following the sequence shown here is important because it helps to clearly define what the program is. It helps us to draw a very clear line between HPOG 1.0 and HPOG 2.0. It will enable you to capture data accurately, and it's also going to be used to establish the 120-day work plans. During the 120-day work planning period, you'll also be establishing contracts, establishing MOUs, and hiring key staff. Ultimately, one of the things that I've referenced is performance progress reports, and you're going to be submitting semi-annual progress reports. Those progress reports are going to be generated by using pages, and we're actually going to ask you no later than 120 days into the project to generate a performance progress report, because while we won't yet have reached the semi-annual mark, it's the performance progress report that we're going to use to make sure that all of your program data has been entered, and it's essentially what we'll use as the 120-day work plan, so that you're not filling out some other additional set of materials or data or anything else. So grantees participating in random assignment must complete an MOU and evaluation design and implementation plan with the evaluation team. You heard a little bit more about that from OPRE, and just know that as we go through this transition period, that we're particularly sensitive to retaining HPOG 1.0 students who are transitioning to HPOG 2.0 and want to make that as seamless as possible. So those are the main points that I had hoped to cover today. I've taken a long time, and I feel like I've been a little bit long-winded. There's a lot of important information there, and I do want to pause to answer questions that you might have at this time. If you have a question, please use the chat box for asking that question. And it's possible that I've been extraordinarily clear and there may not be very many questions. Okay, so there's a question that says, I thought on about hiring key staff prior to there's a question about hiring key staff, and I think that what I've said today is that if the person that's been hired was stated in the application, then prior approval is not required. But if they're not listed by name in like the budget narrative or in the organizational chart, then that's something that you would have to seek approval for. So please work with your program specialist to make sure that we can reconcile anything that needs to be reconciled there. So that's the only question that I've received. I'm going to assume that if you do have questions, that you'll reach back out to your program specialist. You'll find that they're very knowledgeable and very helpful, and will be able to answer questions that you have. Another question is, are MOUs required for all training vendors? And my answer to that is no. MOUs, again, I think that MOUs are a useful tool, but they're not something that's required or prescribed. We would encourage you to use it in instances where it's valuable to formalize a relationship. But I can imagine scenarios, for example, if individualized training accounts or something like that are used where maybe there's not an MOU with an organization. It would really vary from site to site. So another question has come in relation to key staff. If they're already aboard, do we have to get them approved along with new staff? So I think that comes back to just, if they're mentioned by name in the proposal, then you wouldn't have to get approval. But if they're not mentioned by name, then you should plan on obtaining some approval. There's a question about a particular organization that is overseen by a vice president, and does the vice president have to be approved? We give prior approval to key personnel, whether they're paid or not, by the grant. And so if there's a change in the PIPD and potentially in the authorizing official, then that's something that, yeah, we need to be aware of and we need to know about. There's a question, what training will new grantees receive other than the webinars? And there's a couple of things that come to mind here. Number one, you'll be working closely with your program specialist. And so there's going to be a lot that occurs one-on-one, and your program specialist will help to facilitate an understanding of what all of these sort of key points mean to your particular grant. In a similar way, you'll be working closely with the evaluation team, particularly in the development of your evaluation design and implementation plan, and as you establish an MOU with the evaluation team. We'll also have an annual meeting, and we'll have future webinars, and we'll have future roundtables, and there will be training and technical assistance given there. Some of that will be in relation to some grant administrative functions, like how to submit a non-competing continuation application, and some of that training will be very sort of programmatic in nature, like what's the best way of serving individuals with the most barriers to employment. Okay, well, I'm impressed that as many attendees have stuck around as have stuck around. We're very excited to be working with you for the next 5 years, and I honestly believe that we're going to accomplish a lot. We're going to learn a lot, and it's going to be a great experience getting to know people personally, getting to know the nature of their organizations, and just finding ways that we can provide greater opportunity to people and build stronger communities and learn a lot along the way. So thanks so much for joining this afternoon, and we'll continue to remain in touch and work closely with you. Thanks so much, and so long. Bye-bye.